to all patients in the system? And could Richard explain the benefits of data received in planning a PD patient future? I think you might have already covered those, but forgive me.
Yeah, so the paths are certainly, or the monitors, this connected monitoring system would be open to any patients going through the service. I suppose if there's a patient attending a different neurology service who isn't attending the deep brain stimulation service or the movement disorder service in the Mater, they wouldn't necessarily have access to them, because not every centre is fortunate enough to be able to access this technology. We've partnered up with PD Neurotechnology, again, this group of Greek engineers who have developed this hardware, and they've agreed to give us a sample monitor, which we've been experimenting with, and we hope then to establish some agreement with them to purchase this starter set to run as a pilot in specific patient groups in the Mater, and that is the groups going through the deep brain stimulation service. So these are people with advanced Parkinson's disease, with troublesome dyskinesia, troublesome tremor, or significant off time. So these are patients with motor fluctuations, which, as you might know, part and parcel of young onset Parkinson's disease, because people with young onset Parkinson's disease have more years by definition to develop this roller coaster effect of tablets. But we have sent patients, most recently a lady in her early 70s, for deep brain stimulation. So it's not just for young people. So what the monitor will tell us about these patients is how much time they're spending in an off state, i.e. when the pills are not working, how much of the day dyskinesia is an issue, and that can help us target certain targets within the brain for deep brain stimulation, how much of the day tremor is an issue. Very importantly, it tells us about posture instability, that's balance, which can sometimes mark out people who are maybe not suitable for deep brain stimulation, but are more suitable for pump therapies, for example, which we didn't get into today, but the alternative to deep brain stimulation is pump therapy. So the monitors really, as I say, give us a plethora of data to do with movement, and give us some confidence that we're submitting or suggesting patients have very invasive surgeries. So it's nice when you are saying to someone in their 40s or 50s who are already living with a neurological condition, I think you should undergo brain surgery, and risk of bleeding and hemorrhage and disability, which is very small, but what you might say a non-zero risk. It's small, but it's there. Before you would submit someone for such a, almost one of the most invasive surgeries one can have, it's nice to have as much data as possible before you do that. And we hope that these monitors will allow us to gather that data.
Perfect. I'm just with you. When do you plan to have the DBS service up and running in Beaumont, and how many patients do you hope to offer DBS to on a yearly basis?
So our DBS service, we would like to say, has been running for the last year in terms of the preoperative and postoperative work, but we've relied on that key surgical step to be done in London. Once that London surgical step comes back to Beaumont, we hope that will be, I'm always cautious giving dates, but we hope in the summer. We hope there's one key piece of kit which we'll just have on order, and we hope that'll be up and running by June, July. And it's hoped that we may have 2 patients per month operated on in the first year and second year, and maybe moving to 3 patients per month for years 3 and 4, and maybe by year 6 having 50 to 60 surgeries per year, which should really be where we would expect to be for a country of our size.
Very, very good. Thank you for that. And then with regards to the programming on the DBS devices, is the plan for the aftercare service to only happen in Tala and the Mater?
Yeah, so all the programming currently is happening in the Mater. So I work in the Tala and the Mater, and the Mater is where most of the team I work with are. So we're doing the programming in the Mater. So typically we're seeing patients between 2 and 6 weeks post-operatively, and they would typically have a programming session every 2 to 4 weeks for maybe 4 to 6 sessions. So that's one benefit of having programming expertise in Ireland. Where surgery is done in the UK, Irish patients would typically have a programming session at 1 month and maybe one at 3 months, and maybe not have another programming session for a year later. So we're hoping we can squeeze more benefit out of these electrodes by programming them more intensely up front and monitoring side effects, importantly, more closely. So we hope that the overall quality and experience is far improved for patients.
Very good. There was a specific question, or is a specific question here about Galway and Cork, but what's your feeling on that?
So there's absolutely expertise in clearly in neurology, but in movement disorders and deep brain stimulation all over Ireland. Not in those specific centres, there isn't a specific deep brain stimulation service. However, I know in Galway, Paddy Brown is a Parkinson's disease or movement disorders advanced nurse practitioner who himself has expertise in some post-operative care, including programming. So he has all the hardware in Galway to be adjusting patients' batteries. And we will really need people like Paddy Brown, and hopefully evolve some more interested physicians and nurses in Cork, for example, and Sligo, because again, although there's a huge interest in the potential for remote programming through the cloud, there's no substitute for a person on the ground who has some expertise. So over the last 6 months, I've had to meet patients occasionally in car parks all over the country to troubleshoot batteries, which I'm do and is interested in, what we're all interested in doing. However, it would be nice if there was nurse specialists or advanced nurse practitioners or indeed neurologists in each of these centres who are confident in taking on some of the work from us in Dublin. And so, yeah, we're very much into a network idea rather than Mater being the be all and end all. Although we're fortunate to be in the Mater at this point in time to have all the investment and the resources and a large part of the expertise at this point in time.
Thank you, Richard. And in the UK, will they be able to transfer back to, I guess, one of the Dublin centres?
Yeah, absolutely. We're doing it all the time. Yeah, every couple of weeks we're seeing someone who's had the bulk of their care in the UK. So, and we communicate regularly with the centres in the UK to get information back. So, yeah, we would hope going forward there's no need for any patients who have had DBS to travel back to the UK for programming or for new batteries, which is we never touched on actually. So the batteries that are used to produce the brain stimulation, unless they're rechargeable, have a life of 4 to 6 years, and the rechargeable batteries have a lifespan of 15 to 25 years. So there is a requirement for these batteries to be replaced intermittently over a lifetime, which has required up to now application to the treatment abroad scheme and all that entails, which often is a lot of red tape, referral letters going over, travel, etc., etc. So now we hope that Beaumont Hospital will take on all of that activity.
Actually, but the reason why my brain stalled just earlier there was because you mentioned Paddy Brown, and I've never met the man, but he was instrumental in looking after my dad, who my dad was looked after in Roscommon Hospital and that particular area, and I know Paddy was instrumental in my dad's medication balancing and so forth. So a shout out to Paddy. Well done, keep up the good work. And
yeah, fantastic. He is really fantastic. If you could know Paddy and have many more like him around the country, it would make patients' lives and our lives much more easy. So yeah, he's central to the Parkinson's disease and movement disorder service in Galway. So he's a good colleague and appreciated by a lot of his patients.
Yes, so I hope that the network flourishes and gets stronger. That's for sure. You were talking about batteries just a moment ago, and the final question I think I have here is the big issue with DBS is the replacement on the battery. Will this be able to happen in Ireland going forward, and will the monitoring pads be used to monitor before and after the change on the battery?
So yes is the answer. Battery changes will happen in Ireland going forward. So it should just be a day case procedure in Beaumont Hospital, and we're actively arranging that currently. Nothing should change in a strict sense. Nothing should change in the way the system performs before and after a battery change, once the settings are identical. And again, that's part of our role, is to make sure that that process goes smoothly with Ms. Moore and Catherine Moore. So, you know, there are some minor changes that some people experience as the battery wears down, that they'll feel it's not performing quite as well as it was. And sometimes when a new battery goes in, the patients feel that sometimes have too much stimulation and get a little bit of dyskinesia. However, aside from that, which is by no means the rule, there is really no need to be checking using this kinetic system before and after battery changes. It's more before and after the initial surgery, and maybe on a yearly basis thereafter.
Wonderful. Richard, I've come to the end of the questions that we've got here.